Welcome to this episode of the ASHA podcast. I'm Fred Wyant with the American Sexual Health Association, ASHA. We're talking today about the use of the antibiotic doxycycline as post-exposure prophylaxis to prevent bacterial STIs, specifically chlamydia, gonorrhea, and syphilis. It's called Doxy PEP for short, and it involves taking a 200 milligram dose of doxycycline within 72 hours after sex. In 2024, CDC, the Centers for Disease Control and Prevention, published guidelines on the use of doxypep to prevent these bacterial STIs in men who have sex with men and also transgender women. These were the populations that really saw success in clinical trials with doxy. And research shows it works really well. It can reduce the possibility of contracting gonorrhea by about 55% and about 88% with chlamydia and around 87% with syphilis. So it's a really important public health tool that we have. But what's it like in the real world taking doxypep? Well, we're going to explore that today with a very special guest, Oscar Alexis, who's here to talk about his experiences with doxypep and why he chose to include it as part of his healthcare regimen. So, Oscar, thank you so much for taking time to talk with us today.
Of course, I'm happy to be here.
All right, so first question, what led you to take doxypep? And I'm curious, did you start the conversation or did your healthcare provider initiate it?
So I was actually the one to initiate it and bring actually some research and information to my doctor because she didn't exactly know what I meant when I said I wanted DoxyPep. Initially, she actually thought I wanted treatment for chlamydia, syphilis, or gonorrhea, and gave me just enough dosage to take the antibiotics. And I actually had to go back and say, actually, what I want is a preventative, which is, I think, a lower dose. Because I first heard about it because my girlfriend is taking DoxyPep. And I see that you just, take a pill and then like 1 or 2 days, like after having sex, and then like be good and not have to like really worry about, that popping up in like a test. And I already have take prep, for my daily regimen, and I figured that if I have that sense of extra protection, I feel a little less worried. But it also doesn't replace like my safe sex practices as it is. Like I still use condoms for some interactions, and still have those considerations. But yeah, I did have to go back to my doctor and say, actually, what I want is Doxy PEP, which is the preventative kind, and we actually both ended up researching together and realizing, oh, what I need is actually a lower dosage of this kind of medicine so that it's preventative. And we looked up that it's after 1 to 3 days, I can take it, and just to consistently be tested while I'm taking prep to make sure that I'm still, having safe sex.
So it sounds like you had to do some education of the provider, which I suspect is not that unusual. So let me ask you, are there any tips you can offer to somebody if they want to talk about this with their healthcare provider? How do they bring it up and what should they say?
Absolutely. I mean, it really helps if you're already taking prep or if your doctor is really knowledgeable about prep, because that means that they are already open to understanding alternative modalities to sexual health, and for different populations. Also, come in with as much research as you can. I actually think it would have been helpful if I came in with just a printout of, what DoxyPep is, or, who's it used for, maybe even something like a resource for providers would have been extremely helpful, like a one pager I could have downloaded or PDF. Something like that could have at least helped initiate a conversation with my provider and I, and we could have kind of started on an equal footing. Whereas before, where we kind of both lacked a certain kind of information, like I kind of lacked the intimate medical knowledge, she lacked the more, I guess like how it would be applied and, the medical side of it. Definitely coming in with a resource is extremely helpful.
That's a good point because people really don't have a model for these kind of conversations. It's something you can just take with you that sort of scripts that a little bit. I can see where that would be helpful. I'll make a note of that. I think we need to work on
Absolutely.
that.
Yeah.
I should probably back up a little bit and maybe ask a more basic question. So if somebody is sort of on the fence, they're not really sure about this. What would you say to them? Why do you think somebody should think about doxypep for STI prevention?
I think someone should think about PEP, DoxyPep for STI prevention, because it just honestly gives a bit of relief knowing that, maybe this one interaction, I'm unsure of like the other person's status, or maybe a conversation wasn't had where one usually does. Um, I think it can just give one a bit of an ease of mind. But I should also, I think, reiterate that it doesn't replace other safe sex practices. Like just because you take Doxy PEP doesn't mean you shouldn't take your PrEP. It doesn't completely, it doesn't actually do anything against prevention against HIV, and other STIs that could come from other modes of transmission. But someone should absolutely consider it, because, I believe the science for sexual health is changing every day, and we're seeing a lot of really amazing advancements. And I think Doxy PEP is really one of those that we should really take advantage of and have more conversations about. I'm hoping that there is more conversation essentially around people my age, because PrEP is kind of still, new. I still have to have conversations with providers about PrEP, and kind of how it's supposed to work. So it may be an uphill battle, but I'm hoping that more conversations can be had with providers and folks like on this podcast, so folks can, talk more about it,
You
get out
you
more.
make a really good point there that the science of sexual health is continually changing. It's just moving sometimes at breakneck speed. So there's a lot to keep up with. And, when something is new like this, like we mentioned, patients, providers alike have to kind of wrap their heads around it. Um, okay. So I mentioned in my intro that we really want this conversation to be about Doxy PEP in the real world. What's it actually like? And so I wanted to ask about what's your experience of taking Toxic PEP been like? And I think of like side effects. Is it convenient to remember? Just what would you say about that?
It's actually best to take them with some food because they can, cause a bit of an upset stomach. Um, but at least for me, in terms of side effects, the main thing was the stomach issues and maybe a bit of fatigue. But it's just to understand to folks that this is like an antibiotic, and that, you shouldn't be drinking, when you take it. You shouldn't be like really like operating heavy machinery as well. I myself just, the day after it, just took it. I actually think I took it at night and then ate some food and then went to sleep so that, I wouldn't feel the side effects too much. So if folks have an upset stomach or maybe have GI issues like I do, maybe it's something that I recommend.
That's really helpful. Let me pivot a bit to talk about some more maybe societal type issues. Especially, I think it's especially important given our current political climate. How do you think we can do a better job of creating welcoming spaces for LGBTQ folks? I'm thinking about not only the medical office, but just would you just talk about that? There are a lot of challenges, I think, these days.
Absolutely. I think I could talk about that for maybe 3 hours if the podcast allowed. But for sure in the medical office, I mean, something that always helps me feel confident to initiate conversations with the doctors to see like was it like flyers and things, and like one pagers hangs up. I remember when I was living in Baltimore at Chase Brexton, which is a very extremely LGBTQ friendly sexual health clinic. Um, I was getting my prep there, and my doctor had all of these flyers and actually information about Doxy PEP and prep and the different, like shots, and even, different things about just gender expansive health and gender affirming health, and different things about, hormones. And that provided, I think, a sense of comfortability and safety, for me to feel, oh, okay, this provider is knowledgeable about, these different treatments that not all providers are. And I can feel confident to ask questions and not feel like I will be judged or maybe even misgendered or misunderstood. When I say, hey, I want to get on Doxy and prep, I don't want to feel like my provider is judging me, or um, like they can't be curious enough to learn with me. And I think that really is the most important thing. We should really be making sure folks are feeling heard, understood, not felt talked down to, and really felt prioritized, and that their health is important to them.
What you're touching on is a lot of stuff relating to prejudice and stigma. And stigma, we know stigma is such a barrier to people receiving sexual health care in general. We know sometimes people will delay or just not go to appointments at all because it's just embarrassing. And like you said, they're afraid of being judged. I mean, have you experienced stigma directly like that? And just anything you can offer, I think would be, I think our listeners would love to know about it.
I don't know if I can point to a specific moment of stigma. I think I can point to moments of miseducation, and maybe just insensitivity, cultural insensitivity. So there was one provider I had that, I had to come to her, explain what PrEP was, explain that I had to be tested for certain things. And there was a few tests that she initially did that she actually missed. And I had to, message her, go back and say, hey, these weren't done properly and I can't get the prescription and my insurance if you don't do this. And it kind of took some back and forth to convince her that I needed these tests and that this was proper kind of procedure for doctors. So it was a little bit of a, I had to educate my provider, and it felt a little like, damn, should I have been the one to go to medical school at this point? Like if you don't, you can't understand or at least learn to understand these new advances in science. Something I remind, listeners and viewers is to not be afraid to not even challenge, but be firm in your knowledge and know that the information that's out there is correct. And sometimes you may have to educate and gently push your doctor to being open to new information. And I would say if you're hitting a lot of walls, find another provider. I actually ended up switching into another provider who knew exactly what I was referring to when I said PrEP and Doxy. And, it just treatment flowed much easier in that case. So if it's possible, find a different provider who is knowledgeable. And actually, this provider was younger. I'm not saying anything about, age of people because there's a lot of folks who are extremely knowledgeable. I was just, I think, pointing out that there's, I think, generations of doctors that are coming out now out of medical school have, well, let me say, actually, my doctor was from New York City. She's extremely special. Shout out to Dr. Dorsey, I will say. But there are some doctors and a lot of providers that are becoming a lot more knowledgeable about sexual health and especially gender expensive health that I would recommend folks to seek.
I mentioned earlier that CDC guidelines recommend Doxy PEP for men who have sex with men and transgender women. But I'm curious, do you know of people who aren't in those particular groups who may like to have Doxy PEP for STI prevention, or just what do you think about that? About potentially expanding this to other populations?
Absolutely. I think that Doxy PEP should be promoted and educated in almost every sexual health space we have. One, because I think it's not specific to a population. Anyone can, benefit from having a preventative like Doxy PEP, such as they would benefit from having a preventative such as PrEP for HIV prevention. But I think it's extremely important that we expand the marketing of these preventative medicines to outsides of the populations that we usually do because it'll actually fight against stigma, especially these unprecedented times like we're living in now, where we're facing extreme attacks from all sides and all levels, especially for LGBTQ IA plus folks. That I think that the more that we're able to expand this kind of preventative treatment to different populations of folks and educate, especially young people, about these kinds of medications, I think that an extremely better world would be possible tomorrow if that could happen, in my opinion, for multitude of reasons, and I'm sure we could get into for hours. But really, it's just at the end of the day, it really is so that folks are empowered with their sexual health and they understand that there are preventatives and risk mitigation strategies that you can take that could help you, one, provide extremely safe and pleasurable experiences and will make you feel empowered and in charge of your own health.
Well said. I'm only sorry that we didn't connect with you sooner to talk through some of this stuff. This has been great. Oscar Alexis has been our guest today, a very special guest indeed. Thank you so much for your time, for your insights, for your sensitivity. This has been a wonderful conversation. I truly appreciate you I just appreciate you. Thank you.
Thank you so much, Fred. I appreciate you for having me. Thank you.
Oh, it's
Been
our
a pleasure.
pleasure. And thank you, intrepid listener, for tuning into this conversation. Check back with us often as we roll out new resources like this video. We'll have lots of reels we'll be putting out and nuggets from Oscar. Also, send feedback if you have ideas for a future podcast. The info@ashasexualhealth.org. We'd love to hear from you. Until next time, take care, everybody. Bye.